So my topic is about Malar lipostructure, and we need less extensive procedure, natural appearance, just like not operated. This is what the patient asked to us. If it's possible, one-step procedure and more conservative approach, faster recovery, and this is what they want and what we want. And so I think the procedure must be simple, safe, with natural appearance, of course. Inframammary depression is one of the first signs of face aging, and volume augmentation for its correction is safe and efficient. And lipostructure and Malar implants agree with concept introduced for facial surgery in the last decade. And of course, we can use lipostructure, Malar implants, and orbicular fat transposition, and we had two very nice lessons about this. And lipostructure should be considered every time a volume augmentation is necessary in my procedure. And of course, in these years, I use and I perform a different technique, and still now I use a lot Coleman technique. It's only centrifugation of the fat, or the old Caraway technique, washing and filtration of the fat using a strainer, very easy. You can do in an ambulatory, surgical ambulatory. Or I've introduced also the solution system. You have seen probably in the operating room 2 days ago with the cell-enriched fat or enriched of regenerative cell. And now we are waiting. I think we will have able in 2 weeks in CE market the pure graft. That is a dialysis system, can wash and filtration in a closed system the fat. And this is very interesting because it gives us the fat drier, and it's fantastic, and it's very useful also for the face because it's only 2 under 50 and we can have a little bag. And of course we do the Malar augmentation with a single procedure or in combination with the facelift. And like a single procedure, we have to, any case, harvest the fat any time. And I use to perform infiltration with clean solution when we are in local anesthesia, or I utilize only in general anesthesia saline solution with epinephrine. And I harvest with the Coleman cannula connected to the 10 cc lower lock syringe, like you see here. Fat injection is performed. I do access point with the 18 gauge needle, and I inject the fat with the style 1 Coleman cannula, 16 gauge, connected with the 1 cc lower lock syringe every time. And only for lower lid, I inject with the Coleman micro cannula, 19 gauge. And these are the typical access I use to perform a Malar augmentation, but sometimes I need also one kind of access internal point like this, and here you can see a case. And this is a case of Malar augmentation with lipostructure, only 5 cc each side, and you see the post-op lateral view of this 5 cc. And another case of Malar lipostructure with only 3.5 cc per side, but he has also the problem of lower lid, and I inject 0.5 cc per side in the lower lid. Sometimes you have the two problems, and I do this with lipostructure. And these are Coleman technique. Another case, Malar lipostructure with only 5 cc. It's just to augment the Malar area. She doesn't want a lifting. And this is a lipostructure full face of the patient with lipoatrophy, HIV related. I treated a lot of these cases since 1999. A colleague, a friend, infectivologist called me to resolve this problem, and at the beginning, the problem is what we have to do, and of course it's augmentation. This case was resolved with 2 sessions, first one with 10 cc each side, and the second after 5 cc, and you see the result. And this is really a different graft, and you must be attention to understand very well how much you have in the donor area, because normally it's very fibrotic and is difficult to harvest. And this is the example where in which manner I put the fat, like this spaghetti technique, in a net and in a different layer, so superficial and deeper. A patient who has an effect like a lifting, but is only with the Malar lipostructure, and you see also the improvement of the skin quality you have after the lipofilling. And a full face lipofilling with the 20 cc, of course, of malar area, the lateral lower lid, the nasolabial fold, and the marionette, and this kind of result after 20 cc each side. Another lipostructure, the patient need only 5 cc to obtain this result, and you see how it changed this volume of the malar area with 5 cc Coleman technique, and you see also in this the improvement quality of the skin. Another case that gives me the result stable in the time, and she needs 15 cc, and you see that is, for me, is a very good result, and it's very simple to do it because it's only lipostructure without lifting, and you see how the volume is permanent. Another case of full face lipofilling in a patient who, of course, she doesn't want a lifting, a major procedure. She wants only local anesthesia and normal lipostructure, Coleman technique, 20 cc each side, and a case of malar lipofilling and orbicular suspension, just to move and to resolve this problem, you see, with only the orbicular suspension, and 5 and 3 cc of malar augmentation.